So you thought you left acne behind in your teenage years, right? But now here you are, as an adult, dealing with these stubborn breakouts. Well, if that sounds familiar, you are in exactly the right place. We are about to dig into the real reasons behind adult hormonal acne and, most importantly, build a solid plan to finally get it under control. Let's get into it.
Okay, this is the question that drives so many of us absolutely crazy. You're using the same products, the same routine that cleared things up years ago, but these new breakouts, they just laugh in your face. The frustrating truth is, you're not fighting the same war anymore. It's a whole new battle.
And this right here really breaks it down. We're talking about two completely different conditions. Remember teenage acne? That was all about the T-zone, your forehead, your nose. But adult acne loves to set up camp in the U-zone, all along the jawline and chin. And we're not just talking about little whiteheads. No, now we're dealing with those deep, painful underground cysts that are caused by very specific shifts in our hormones.
And hey, if you're feeling like you're the only one going through this, I want you to look at this number. A staggering 50% of women in their 20s are dealing with this. It even affects about 25% of women in their 40s. So you are absolutely not alone. This isn't some personal failure. It's a very common biological thing.
All right, so here's our game plan for this explainer. Think of us as detectives cracking a case. First, we're going to go undercover and investigate the inside job to identify the main hormonal culprits. Then, we'll look at their accomplices, diet and stress. After that, we'll build your complete, holistic treatment plan. And finally, we'll talk about when it's time to call in the professionals for some serious backup.
Okay, first up, the inside job. To really understand what's going on, we have to look under the hood, you know? We need to get to the absolute root cause of these breakouts.
So, meet culprit number one, a group of hormones called androgens. You've probably heard of the most famous one, testosterone. And yes, it's totally normal for women to have androgens, but things get tricky when their levels fluctuate, which happens around your period, during pregnancy, or even just from stress. When these androgens tick up, they send one loud, clear message to your skin: make more oil.
And once those androgens get going, it sets off this breakout chain reaction. First, the androgen surge. Then, your oil glands go into complete overdrive. All that extra oil, called sebum, mixes with dead skin cells, and you guessed it, your pores get clogged. This creates the perfect, cozy little home for acne-causing bacteria to move in and thrive, which leads to those deep, inflamed blemishes we all hate.
But here's the thing, hormones rarely act alone. They have accomplices, outside factors that can take a tricky situation and make it so much worse. Let's investigate two of the biggest ones, your diet and your stress levels.
And the evidence? It's pretty darn clear. Study after study has shown that people who consume more dairy, especially skim milk, interestingly, and a lot of high-sugar foods like pastries and sodas are way more likely to struggle with acne. So what's the deal? What's the connection here?
Well, it really all boils down to this, the insulin connection. When you eat those high glycemic foods, your blood sugar spikes. Your body then releases a flood of insulin to manage all that sugar. But here's the kicker. That insulin rush also tells your ovaries to produce more of those oil-triggering androgens. It's a direct line from what you eat to the hormonal chaos that causes breakouts.
Now, this does not mean you can never have a cookie again, okay? But it does mean that making some smart swaps can have a huge impact. Focus on loading up on low glycemic foods, like veggies and whole grains. Swap sugary drinks for water, and try to get more of those anti-inflammatory omega-3s from foods like salmon and walnuts. It can all help break that vicious cycle.
All right, let's talk about the other major accomplice in this crime, stress. And this isn't just in your head, it has a real physical impact on your skin. One study found that for about a third of adult women dealing with acne, just daily stress was a direct trigger for making their skin worse.
So here's how it works. When you're constantly stressed out, your body is pumping out cortisol, the stress hormone. And just like insulin, cortisol sends a signal to your body to ramp up androgen production. So whether it's from a donut or a deadline, the end result is the same, a hormonal flare-up that leads to more oil and, yep, more acne. Okay, so we've identified the culprits and their accomplices. What now? Well, it's time for a whole new game plan. We're going to build a holistic toolkit to fight back. But this time, we're going to fight smarter, not harder.
First things first, we have to throw out the old playbook. You know, all those harsh, drying, burn-your-face-off treatments from when we were 16? They have to go. For adult skin, that approach is completely counterproductive. It just damages your skin's protective barrier, which then freaks out and produces even more oil to compensate. The new approach is all about being gentle, supporting that barrier and calming things down.
Okay, this is a really smart strategy you can start using like today. It's called cycle syncing your skincare. Think about it. In the first half of your menstrual cycle, your skin is usually behaving itself. That's the time for maintenance. But in that second half, the luteal phase, oil production skyrockets. That is your cue to get proactive with ingredients like salicylic acid or a good clay mask that keep those pores clear before a breakout can even think about starting.
And speaking of your toolkit, let's talk supplements. Something as simple as spearmint tea, just 2 cups a day, has been shown to have anti-androgenic effects. Zinc is an amazing anti-inflammatory, and DIM, which is a compound from broccoli, can help your body process hormones better, though for something like DIM, it's always best to work with a doctor or practitioner.
And what about those super frustrating marks that hang around long after the pimple's gone? Those red and pink spots actually have a name, post-inflammatory erythema, or PIE for short. It's not true scarring. It's actually damage to the tiny blood vessels right under the skin's surface. It's super common, especially in lighter skin tones.
So how do you actually deal with this stuff? Well, it's a 3-step process. Step 1, and this is the hardest one, prevention. You have to stop picking. I know it's hard, but it makes all the difference. Step 2, protect. Sunscreen every single day is non-negotiable because the sun will make those marks darker and last longer. And step 3, treat. Look for powerful but gentle ingredients like niacinamide, azelaic acid, and vitamin C to help speed up that healing.
Look, you can do so much with these lifestyle tweaks and a smart, gentle skincare routine, but let's be real, sometimes you need to call in for backup. Let's talk about when it's time to bring in the pros.
So, when is it time to make that call? Well, if your acne is getting severe, if it's really painful or you're starting to see scarring, that's a clear sign. If you've been consistent with over-the-counter stuff for, say, 3 months, and you've seen 0 improvement, it's time. And honestly, if it's just causing you a lot of emotional distress, that is a perfectly valid reason to seek help.
When you see a dermatologist, they've got some heavy-hitting options in their arsenal. There's spironolactone, which comes in a pill or a newer topical cream, and it works by directly blocking those androgens in your skin. Certain birth control pills are actually FDA approved to help with acne by regulating your whole cycle. And of course, there are prescription-strength retinoids, which are absolute powerhouses at keeping pores from getting clogged in the first place.
So if there's just one thing you take away from all of this, let it be this. Adult acne requires a totally different mindset. This is not about declaring war on your skin. It's about a gentle, holistic, and, this is the big one, patient approach. You are finally treating the root cause, not just zapping the symptom. All right, we've gone through all the evidence in this explainer. We've looked at the patterns, the triggers, the internal culprits, and the external accomplices. So the final question isn't for me, it's for you. Now that you have all the clues, what do you think your skin is trying to tell you?